If you call the poison control number from South Dakota, the 1-800-222-1222 number, that call is automatically routed into Minneapolis to the Hennepin Regional Poison Center. The staff there answer the call as Sanford Poison Center because they know it's coming from the state of South Dakota. Our current involvement with them is we do a lot of education within the state. We partner with them on getting statistics for poisonings, trying to come up with new prevention guidelines or new prevention strategies. The Poison Center receives about a little over 6,700 calls in 2017. And of those 6,700 calls, that was in a year, over half of those were from a private residence. And the rest were from businesses or medical centers calling when a patient comes into the emergency room, how to treat them. Over half that originated from a private residence. Over half of those, or actually almost 60% of those, involved a child under the age of 5. We recommend walking room by room on your hands and knees and just kind of looking to see how high you can reach, what they might pull off. In addition to ingesting things, they can also knock stuff down on top of them. There's a significant number of kids have been injured by flat screen TVs falling on them. So get down and actually get that kid's point of view. This is a bottle of Clorox. This is a jug of milk. A 2-year-old probably doesn't know the difference, and if this is sitting on a counter, probably not going to swallow it, but they're probably going to reach for it. And if they reach for it and the cap isn't tight, it could spill onto them, it could fall onto the floor, it could hurt them, it could splatter onto the floor, and then they're stuck in that product. So, out of sight, out of reach, locked up. This is Pine Sol. Something you don't want to drink. This is apple juice, something kids want to drink. If they're sitting like this, a child's not, even a 5 or 6-year-old may not notice that. So you want to, again, Pine Sol, other cleanings, lock it up, out of sight, out of reach.
We see a host of various poisonings come through the emergency department. It's split up between, a lot of times there are patients that intentionally try to harm themselves by taking too many of their medications. And then also we see a fair number of children who have inadvertently got into another person's medications. It could be an adult, a parent, a grandparent, another one in the home where the child is at. So that comprises a lot of the poisonings we see. So one thing that we strongly encourage is if you're prescribed a medication that you no longer need, if an acute injury is over, is to dispose of those medications in an appropriate manner. And one of the big things is you can take the medications to an authorized take-back center, and they will dispose of the medications in a safe, effective way to keep those medications off the street, and they could potentially get into the hands of people that could use them for recreational purposes.